afternoon, ladies and gentlemen. Welcome to this special town council meeting on this September 6th, 7th, 2021. Thank you for coming. If you would, please stand for the Pledge of Allegiance. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, this agenda this evening is, in writing, is short. This will be further discussion on the COVID implementations that have been taking place, and the council may discuss different alternatives. And then after that point, we will go into a closed session to discuss some possible property acquisition. So thanks again for coming, and would you like to lead it off, Shane?
Certainly. Thank you, Mayor. That is correct. So we do have two items on the agenda. One is open to the public. The second is closed session. Just an update. We did meet 2 weeks ago today at 5 o'clock on the 24th of August. We did update or amend our state of emergency that we had put into place on August the 10th. We amended it to require face coverings or masks to be worn. While indoors in any establishment open to the public and in areas that is open to the general public, all customers, employees, and any other occupants or users of such area shall wear a face covering. While wearing a face covering, social distance 6 feet shall still be maintained so far as possible. We obviously still had a couple exclusions to that, medical or behavioral conditions, children 2 years or younger, and customers dining in restaurants and while customers are sitting at their table. Or when a person is complying with directions issued by law enforcement officers. We did put a grace period, so to speak, to educate. During that time, I think we've had just one issue that I'll speak of in just a few moments. We did put a penalty in place. This was similar to the town of Boone. A violation of this section, or the section I just read, Section 2, shall constitute a Class 2 misdemeanor. Provided under General Statute 166A. We gave the public until September the 10th, which is this Friday, before any citations potentially could be issued. We did hear from Chief Miller last meeting as well on the DA's take of this particular amendment that we put into our state of emergency. During that time, we've been able to put 2 traffic signals. We were unable to get those from DOT due to the impeding hurricane last week, so we went ahead and made the decision to rent 2 traffic signal or true traffic signs to put at North and South 321. Had some good reviews from those. Sandwich boards, the Chamber has assisted us again in helping order and provide the printings. We provided some of the boards. I think we have a total of 6 on Main Street and Sunset. Also with the Chamber and the TDA, uniform messaging and signage has been sent out to all the businesses and asked for those to be placed in the windows. To my knowledge, we've had one issue that was not really a large issue, but one issue in which the police were called and the situation was taken care of. Other than that, we've not had any issues called into our police department or into town hall from a mask mandate standpoint. So it appears to be going fairly well. Update on numbers as of today. Watauga County has 5,442 cases. That's 302 more than on 8/24, 2 weeks ago. There's 93 active cases today versus 87. That number has been as high as 150. Again, that number does fluctuate as COVID has during this time. 143 actively being monitored or quarantined. That number has been as high as 220 in the last 2 weeks. And the 150 was as high in the last 2 weeks as well. I believe there's 20 this afternoon at the hospital. Again, that number does go up and down. It's been as low as 10. It's been as high as 20. In the last 2 weeks, it was 18 on 8/24. Since we met last, we do have 4 new employees that have chosen to become vaccinated. 2 today. So that was 2 as of this weekend, or 1 this weekend, 1 yesterday, and then 2 more today. So we've had 4 new employees. That does push us a little bit above 65%. We still have 24 full-time employees that are unvaccinated as of today. That incentive program, we did extend it through today, the $150 or 3 days. And we did put on the table last time, but did not vote on it, potential mandatory testing for those that are unvaccinated. So that's a fairly brief overview, and I'll open the floor up for discussion and any questions I may be able to answer.
Where are we at on, how many employees do we have that are positive?
Currently, 2.
Do we have a total of how many in the last month?
5.
Okay.
We've had spouses and children that have required quarantine as well, but I don't have that exact number. That number fluctuates on about an every other day basis until testing is had, negative tests are had, that type of thing. So that number does, the quarantine number fluctuates a lot more than the positive number. So two today, and I think 5 in the last month.
Okay.
And you said, other than the one incident, that's been all the incidents that we've had that the police forces had to be called in on?
That's correct. I spoke with Chief Miller today. I don't believe we know of any other incidents other than the one that took place at last weekend. Not Labor Day weekend, but the weekend before last, the first full weekend. We had an individual, I think, that was unsure, maybe not willing to comply initially, but police did arrive within a couple minutes, and the individual was much more willing to cooperate at that time. So.
I think the other thing we need to look at in addition to Watauga County is the U.S. stats. The license plates that I saw in the last 2 weeks have been North Carolina, South Carolina, Georgia, Florida, West Virginia, Wyoming, New York, Maryland, and Virginia. I think the biggest statistic that I read today was the American Pediatric Association said that 500,000 children were diagnosed with COVID from August 5th to August 26th. That's a frightening stat. Currently, there were 26,000 deaths last month in the United States, and our total numbers are 4.2 million, based on the Johns Hopkins board that they've been using since this started. So I think we're not just looking at Watauga, we need to be looking at the whole picture, because I think people are coming here.
They're coming here and they're staying in VRBOs. So they're not, I mean, that's where we're seeing our big occupancy tax and revenues from that. So I think people have kind of learned that they feel safer in separate houses rather than motels and hotels and stuff like that. Although, she was here earlier, Meadowbrook. She said they had a pretty good occupancy at Meadowbrook.
Yeah, July, we just
For
finished our
July?
TDA meeting. July, we were 52% over last July in overall TDA revenue.
Let me ask you this, Ms. Sweeting, what is your goal here? What good does it do us to look at the national numbers?
I think as the numbers increase, it means that our risk increases. And now that was the point for the stats.
Well,
We have it in Watauga County.
We are a tourist town.
Right.
So unless
Which-
you throw gates up, these people are going to come. We had a senator from North Dakota visit the Rock this weekend. I mean, I don't understand what those numbers are going to do for us here.
Well, I think it's to make people aware that our numbers are going up. I think our employees and our job is to protect the health, safety, and welfare of our employees, our residents. And I think we need to look at, are we doing a good job with our own employees? That's what.
I was thinking over the past 2 weeks about your points about we need to protect our children and the children, and you just said the children numbers are going up. But then it kind of settled in, and well, of course, they're more, the common sense part of it settled in. Well, there should be more children cases now. because the first thing we did with COVID was vaccinate our elderly population. Remember, there were 5 groups. And they said, first of all, the people that get the vaccinations first are our elderly population. And our populations that are in harm's way are, help me with the,
Immunocompromised.
are immune compromised. So we should see more children. So I think we need to calm down a little bit. I still don't feel afraid. I'm not afraid. I think that a big indicator that we should wait for, perhaps, is we just had 2 big gatherings that may affect our local population, and that's the Luke Combs. What were those numbers? 32,000. I've heard they're up to 39,000 for that concert. That was Saturday night, right? And then we had the big App-State ECU football game, so there might have been some college kids or locals that went to that football game and came back. And when was that football game? Was that Saturday? Thursday. So if those 2, and you know better than I do, if those were what do you call them?
Super spreaders.
If those 2 things were super spreaders, then we should see Friday, how many days? 10 days?
It's 14 days.
14 days? We should see some numbers come back.
Well, and let me correct one thing about the children. The reason why is the Delta is much more contagious, and I don't know if your children ever had chicken pox, but it's about as contagious as chicken pox. So I think when my kids were little, it was like, oh, everybody in kindergarten gets chicken pox. But the other big thing is they can't be vaccinated, and I think it's our role to help protect them. And a mask is one issue. But the other concern I have is our employees are out in the public. Chief Miller, do you have any police officers that aren't going out and being involved with the public? Or are they all behind a desk?
No, they're in the public.
Okay. So, we're being seen. I think the sanitation workers, Public Works, all of us. And so, those are the reasons to make options available to the employees. So I don't think it's being hysterical.
I didn't say hysterical.
Well, I'm just saying that it's a pandemic. Pandemics are a little scary.
So what's your point, Sue? How would you like to move forward with this? We've got a mask mandate in place, which
Right.
I have noticed that, at least my place of business, 99.9% of the people come in with them. Everybody's so used to it now. And they don't, and they're given masks. Downtown, I noticed it this weekend. Now, outdoors, no, they're not wearing masks. Of course, we didn't require masks outdoors originally, only if they couldn't maintain 6-foot social distancing. So, all that being said, I think you guys have made the right decision. Okay, we've got masks in place. How do you want to go forward?
Well, I would like to make a motion, and I hope someone will second it for discussion, that we have employees that are not vaccinated and that they have 3 choices.
Okay, what are those choices?
One is they get vaccinated.
Okay,
If they choose not to get vaccinated, they be tested weekly for the coronavirus.
okay, tested weekly.
And if they choose not to be tested, that they may consider leaving the employment of the town.
I'm sorry, that you make them what?
That they would leave the employment of the town of Blowing Rock.
On their own accord or by termination?
Well, it would be on their own accord because they've been given choice number 1 and choice number 2, and choice number 3 is that if you can't comply with those, then you're not supporting your employees and you're not supporting the residents and the public in this town.
Okay, how about the ones that have pre-existing conditions that may not warrant the vaccine? How would
Well,
you
we
handle
have two immunocompromised
How would you- no, no, I'm asking how-
employees,
yeah, how would
and
you
they
handle
can get it. So, I mean, pretty much, the healthcare providers or physicians are not recommending you don't get it. They're just picking the time when they do.
Why has Appalachian Regional Healthcare not mandated it for their employees?
They're down 165 employees. And if they, from what I understand from an employee that works in the hospital, if they start doing this kind of thing, then we're really in trouble, Sue.
Well, they have travel nurses, and unfortunately, they've lost a lot of people to travel because it pays better. They are starting to do incentives, and that's not,
But I think we need to second this, that being she's already made the motion, we need to second this before we start all this
You
discussion
seconding it,
back and
Doug?
forth. I'll second it for discussion.
Okay, now it's up for discussion.
And I
Now
don't-
y'all can go back.
okay. I don't think, I mean, I'm not, I think we've got to do what we think is right for the safety of our people. I'm sure there are reasons that Appalachian's not doing it, but dragging them into this is not, I think, helpful to our discussion.
No, it's just by example, because we're running from example by Boone as well, so are you.
No, I'm about what I want. I mean, I'm about helping our residents and helping our
When is
employees.
Appalachian State mandating it?
I have no idea.
Okay,
Where-
so they haven't yet.
No.
Okay.
No, but they have made testing mandatory.
Your motion's limited to employees.
Yes,
Correct.
that's
It's
correct.
just the
How
employee.
can you, in the same breath, include the entire population of the world?
I think it's safety of the people that are, the employees that are here that are immunocompromised. I mean, I'm amazed that there are people that aren't protecting their friends that have cancer, that they are choosing not to be vaccinated.
Can I,
Yes,
Shane,
ma'am.
can you comment any regarding the potential logistics of something like this in terms,
From a testing standpoint,
from a testing standpoint?
you know, I would comment based on my conversations with Boone, who has implemented a similar program. So they do testing on Mondays and Wednesdays. It's done through their paramedics at the fire department. They've been trained through the health department to provide those tests. They're rapid tests. So the testing results are provided the same time as testing. It's about a 15-minute, I think, delay. They're keeping tabs by, similar to what we did, I guess, from the incentive program. The HR director has a list of employees that aren't vaccinated, and then the testers themselves obviously have that list to cross-reference as they come in to get the test. And then if anyone tests positive or if there's symptoms, then they are sending them over to AppHealth to receive the PCR test, which is the more, I guess, conclusive test, definitive test within that.
Who's paying for the testing?
AppHealth is paying for the test.
So that would be no cost to us.
It is not a cost right now. That is correct. Boone has put it out for an indefinite amount of time. I talked with Jennifer Green today, the health director, and she said that obviously as more tests are being required, I think they're testing about 200 a day right now. That could very well become an issue later down the road. It's not currently. They've got plenty of tests, but that is something to keep in mind as more and more people are tested. She said that there could be a cost associated with that later, not currently, but they'll have to determine that.
So that would get administered through our fire and rescue?
So anyone that has a medical, training, as in our paramedics, would be eligible to be trained through the health department. It's a very simple process to go through. It could be a part of that. That's the route that Boone chose. So I don't want to. That's the only example that I can give that I've talked with personally.
Are they having problems in Boone? Why in the world are they doing this?
Boone put it into place as part of their original SOE that was passed early August, and so testing was implemented. I think they're in week 3 of testing. So
Their employees are getting sick? A lot of their employees are out and they're sick, and is that what the problem is?
I don't know the details of their employees. I know when they originally agreed to put the SOE in place, that was a part of that policy, was to offer the exact same incentives that we have here, the $150 for 3 days, and then the testing was to commence within I think, a week of that time frame. So they've been doing testing for about 3 weeks now. I know they originally started with 67 employees that did not have the vaccine. I think I was told today by John that they've had 13 since then receive it. So they're down to 54 of their employees. About 200 employees is what they have overall. Boone does.
Who else besides the county and not the county, the town of Boone and Appalachian State doing mandatory testing right now? I know that's their two largest places in the county. I mean, that takes pretty much 85% of the population there. So.
Duke Hospital just mandated.
Yeah,
They did that a few weeks ago.
yeah. Off the mountain, there's, I think the majority of your universities and campuses are towns, Durham, Winston, Forsyth. Locally, in this general area, there's not another one. I did check with Lenore today. They have not put anything into place yet, but there's others, Chapel Hill, et cetera, that are out there, Orange County.
I've heard that Dr. Elliott had thought about it. Are they doing it or not?
They're not doing it as far as
Not yet. I know that's being talked about.
I think last I heard from Dr. Elliott, I believe they were over 90%
Right.
vaccinated to pretty significant percentage.
That's the.
And just to go back on one last thing, just to go back on the mask, it would have been nice, and I was trying to look it back up and I couldn't find it, to have had that poll that come out the next day from that the TDA had done, if you remember seeing that. 72% of the tourists here in town said they'd be glad to wear a mask, and encouraged it. It was the poll was amazing when I read that. I think it was only like less than 10% that said that they wouldn't. But at least we know somebody's been out here in the public.
I don't think masks are really an issue. I think that it's something that's the new norm for a while. I mean,
You won't check my voicemail?
Let me ask a general question, and I do not want to get into specifics, but at one time, the vaccinated versus unvaccinated in terms of town employees was very segregated two departments. Is that still the case? Okay, if that's the case, then would it be safe to infer that there's a higher chance that an infection could really greatly affect one department over another? Looking at vaccinated versus unvaccinated.
I'm not sure if I'm qualified to answer that. I mean, from who can and can't, obviously contract it and spread it. I don't know the details there. I will say that we do have, and then maybe Sue or someone can speak to that more. We do have two departments that have larger percentages unvaccinated than the others. We have seen recent positives within a department that has more vaccinated than not as well. So that's why I'm not sure if I'm qualified to say that. So
I have a question of Alan. Sue has, in her, correct me if I'm wrong, Sue, the ultimate penalty is termination of an employee.
If they choose not to do choice number one, choice number two, then I would think that choice number three should be that if they're that strongly against it, that they should seek employment somewhere else.
Well, the question I have with the town's attorney, is that legal?
I believe it is.
Okay.
So, I mean, look across our state, look at other counties, municipalities that have already put this rule in place. It's not like we're pioneers.
Well, just because you can doesn't mean you should.
I don't mean that. Another thing that's really
Were you
bothering me,
through, Mr. Moser?
I'm sorry.
Were you through?
I'm through.
Okay.
this bothers me, and I'm just asking for everybody here to help me with this. I said 2 weeks ago, I had faith in the governor. It's 2 weeks later, and I have seen no mandates issued by the governor of North Carolina anywhere in North Carolina except maybe his personal staff.
I think it's personal staff.
Now, I want to know why it is that the governor of North Carolina is not mandating all these things, and we are.
He's not mandating state employees.
That's
I would-
bothering me a lot.
Yeah. I mean, I can't, it would be something you'd have to ask him. I'm sure there's a lot of political pressure.
I do have a question. If we're mandating, if this takes place, and we mandate that these employees be vaccinated or tested or make a change, what happens when the question arises, are we going to be testing those people that were vaccinated because they have been known to get the COVID as well?
The only time you would test them is if they're symptomatic, because you're wasting the reagent.
No, it's not about
and the
waste. It's
swab.
not about waste.
Well, it is if you're testing people that have been vaccinated, because the more likely one to get it are the unvaccinated. True, there are breakthroughs, but you're more likely to be exposing the citizens of this town and other employees to somebody who could be positive that's unvaccinated, because that's the most likely one to get it.
Okay, well, I'm sure that'll come up. That's why I wanted to mention it.
Yeah.
Okay.
As a clarification, this would include council members as well?
No, because council are elected officials.
Employees
No,
as well?
We're an employee.
We didn't get that raise the other day, so I guess.
I didn't think about employers. I mean, council.
I guess
That
it
would
would be.
be
If we
something that
mandated
you all could put in the, if you wanted to include council.
If you mandated it for town employees, I guess, would that, Alan, your take on it?
I would say yes. You get a big paycheck, don't you?
Yeah.
Yeah.
Yeah. Oh, yeah.
Okay, thank you.
Alan, if I may ask, so if we put this into place and give 3 options, and can an employee legally refuse any of the options? I asked for clarification from a termination versus a resignation. You know, having a choice doesn't sound like termination, and termination equals unemployment potential. And so any thoughts on how that would play out?
I think what are you asking from the standpoint of, okay, so the third option is the one they choose, which is to not get vaccinated or get tested, and then their employment is
Ceases.
deemed to be terminated. I think what you're asking is whether that was a voluntary act on their part, and it could relate to their ability to collect unemployment.
Correct.
That's your question, isn't it?
It is, but by giving choices, does that take away their rights that you would have under termination?
So I guess my answer is, I don't really know, because I think this is sort of a precedent-setting situation for us. I mean, normally in a termination situation, if someone is terminated for cause, then they're not going to be allowed to collect unemployment. And so the issue here is this for cause because they refuse to either get vaccinated or get tested? And honestly, it's probably something that's going to have to be established in court.
Yeah,
So
and-
meanwhile, our trash doesn't get picked up, and we don't pull the speeders on 321, and we don't get our minutes written up, or we don't get, the kids don't get after-school care, or we don't get the leak plugged on Main Street. Are you gonna?
Why would we not get any of that?
If we start losing employees, David?
You know, I got a call from somebody that wanted to know if we had any job openings. Because they heard, because they heard that we had after-school care. And people are having trouble getting babysitters.
I know it is.
So I did get a phone call. So there are people that that want jobs. And I think the average pay with benefits for our employees is $59,000. I think that's a pretty good deal
I just,
to walk away from.
it just, this, to me, this is a very negative situation that you're putting us in. We've been, I felt like, from the beginning, very supportive of our employees through the pandemic. How can we help? How can we work together? How can we keep each other safe? And now we're just pulling the rug out from under people. And, you know, what's it going to be next? How many children you have? Are we going to test for that?
Well, I think you don't need to go there. I think we were very good to our employees, and we kept them all in their jobs. I was a little disappointed that only 6 with the incentives we offer, 6 or 8. Has it gone up?
From the beginning?
Yeah.
There's been 8.
8
Yeah.
employees out of the ones that are not vaccinated chose to make the decision on their own. I mean, that was a pretty nice incentive. And now we have a situation that we're trying to protect the welfare of the other employees. And I think you need to consider them also. It's not just about the ones that are unvaccinated, it's about the other employees.
Well, I don't think that, I mean, unless I'm just totally wrong, and I don't think so. When you say that our unvaccinated employees are putting the other ones at risk.
You have a physician sitting right out there if you'd like to ask him.
Well, no.
No.
Or he can shake his head. I mean, they are. I mean, you're...
So I don't think that our employees, I think they respect each other enough that they're wearing masks and they're not getting each other's face. And I don't see that we're having super spreaders within our employees. I don't see I mean, maybe we should put some sort of,
Well, we just had 5 positives in 30 days. And I don't think everybody knows who's vaccinated and who's not. So you're relying on the other people who aren't vaccinated to put the mask on. So, I mean...
Further comments?
Yeah, I appreciate what Sue says, and I appreciate Virginia's perspective as well. If my company or Charlie's company were to have a lot of employees that showed up with COVID, it affects my company, and affects his company, and it stays right there. If we have an outbreak within the company of Blowing Rock, the town of Blowing Rock, it affects thousands. It affects services that we provide for 6,000, 7,000 people this time of year. And with 2 departments that have a high percentage of unvaccinated people, I'm afraid that critical services could get compromised. So I would rather, I'm not a big fan of having everybody test every week, but I'm more afraid of critical services being interrupted because we didn't act quick enough to nip it in the bud and identify someone when they got infected. So I don't like talking about termination and all of that, but I do think that if we had a higher percentage across the board than 67, that I would not support this. But I'm more afraid of us not being able to provide safety and welfare for the larger population.
Has that happened, Shane? Are we not providing services to our population?
Yes, I mean, we've not had a situation, since the shutdown, that we've not provided all the same services. We've had to maneuver and juggle and isolate, and, during the last 15 months, we have. That's been...
I feel like we need that situation before we do something as severe as this.
It's too late. If
I
you wait
beg
until
to
the
differ.
situation, then it's too late. That's what you're trying to do, is
You know-
take the step before it happens. Because when you get in that situation, that's a problem. And that's why you have, this is all new area, but.
No, it's not
If you
new.
look at your stats, people are getting sick.
But we've done this before when we were all unvaccinated and we had our systems set up. And I don't know if are people not willing to do the systems where they're partnering and with the enforcement and the public works? Are they unwilling? Is that what's changed now? That they're unwilling to partner, and has that changed?
No, there's been no change. We've essentially, other than closing town hall, we've gone back to similar operations of keeping groups together and things of that nature, but it's
I
not...
see them wearing masks in their trucks.
Yeah.
I see them wearing masks in the cars.
How many are not vaccinated?
24.
So we have 24 that aren't vaccinated.
Correct.
Can we operate without 24 people tomorrow morning?
No, probably not. Not as the same as we are right now. That'd be a difficult thing to do.
I just think termination of a guy that's been here 10, 12, 15 years is too draconian. I just think it is. And I'm basing what I'm saying is, I see the governor of North Carolina. I don't think anybody's been fired from state government yet over this. And just why is it, if that's true, that we're setting ourselves up as the model for firing people?
Well, do you feel like that 15-year tenured person would not want to be tested? What's the issue with being tested?
I don't particularly have an issue with testing, but somebody else may. We haven't talked about testing. What's bothering me is this medieval thinking of firing people that have been serving us for a long time. What the hell does that do to what they think about working for the town?
Well, there's a
I'll tell you what it
choice.
would do to me. You'd never see me again.
There's a choice. They have a choice to get vaccinated. They have a choice to get tested. The issue is, what if they choose not to do vaccination or be tested? Then what do you do?
Well, if the nation follows us, there's going to be one hell of a bunch of unemployed in this country.
I just, I'll be surprised if people give up their salaries and their benefits, because I think that's a big choice. I'd rather get a Q-tip up my nose.
How many did Boone
2020.
lose, Shane?
I'm sorry?
How many did Boone lose?
4.
4.
Four out of
How many do you
200.
think we could lose, Shane?
I don't know. That's a true answer. I don't have an answer. I've had a number of employees, and I say a number is in a handful or more, a half a dozen or more, that have said that they do not, want to be tested. I don't know how many of them. I don't have an answer there of how many of them would leave.
You know,
College, you have a, on them?
On the college?
Yeah.
I don't have a number on that.
Council, I am in favor of the shop by all means, okay? And I'm in favor of choice. Our country was built on choice. Our country was built on being able to make good decisions by adults. Yes, I feel like that everybody should get a shot, should get vaccinated. If more people had gotten vaccinated, maybe we wouldn't be in the position we're in now. We also have to look at this. During 2020, a lot of these employees stayed with us when they could have gone other places and made more money. They stayed with us. Some of their families got sick, and they stuck it out. These could be some of the same employees I see working on Main Street at midnight on a Friday night, fixing a water main. And other places I've lived, that water main would have waited for a week. I'm in favor of the vaccine. But I think the either or concept, I don't think it's fair right now. That's just my opinion as mayor, as a citizen. So,
You say right now, when do you think it is fair?
I'm not God, don't know.
Well, you shouldn't say it's fair right now if you don't have an answer.
I said as mayor, as a citizen, okay?
That it's not fair right now.
Well, we're
Look at
dealing
how
with-
many people have gotten the shot.
Yeah, we're just dealing with a variant that's
6, been vaccinated since the 24th? 4.
And I think that's wonderful. I just would have hoped more than 6 or 8 we're up to now. And this variant is dangerous. And I think one of the reasons to do it is you're impressing on people, we've got a pandemic. This is a serious situation, and we need everybody's help. So.
If losing 650,000 U.S. Americans doesn't convince the population of that, I don't think blowing rock's going to make much progress on it.
Well, I would hope that any child in the town of Blowing Rock or grandchild doesn't get sick because an employee that we have goes up and talks to them and spreads COVID to them. I mean, those are as dramatic as your situations and as dramatic as yours. So,
Well, I think there's a lot of misinformation. I went over Friday and got a Moderna booster.
you got a Pfizer booster. Moderna's not out.
Well, then it's worthless because I had Moderna before.
Right.
But I gave them my little cards you get, and they stuck the needle in my arm, and I get home and watch television, and it says Moderna's not even going to be asking for approval until 2 weeks from now. So what is going on?
Well, I'd rather get back to this at hand than talking about the
All right,
booster. That's a whole other thing.
We have a motion. Sue's made a motion. We have a second. And, all right, go ahead.
Is there an option other than termination?
Sue?
Another third option other than that?
Well, the issue is if they don't get vaccinated and they refuse to be tested, then what do you, I mean, can you think of another one? I
Administrative
mean-
leave without pay,
Take leave without pay?
leave without pay.
Well, they're
Oh.
gonna, so,
I didn't think of that. That's a good one.
well, I mean,
I would,
ultimately, you're saying they're gonna get sick. Isn't that punishment enough? I mean,
All right. What were you gonna say?
I was gonna say I'm not weighing in on for or against. I would say when you do leave, depending on the timing and how long that leave is, it can also put the same department in a bind because it doesn't allow us to hire back. And I'm not, again, not saying for or against, but just simply saying,
No, I-
if you have
I
enough people
agree.
on leave, you don't have the ability necessarily to hire to replace those individuals while they're on leave. And so just something
There's some
to
limbo.
keep in mind logistically to do.
I appreciate that.
Now, can you expand on, you said 4 people had quit at Boone? I mean, I really don't care about Boone except this question. Can you expand on that?
I don't have a great amount of detail. I was told 2 had taken early retirement, they were eligible, I guess, or had the years in, and 2 resigned. I don't know the details of the types of employees, tenure, et cetera. I don't have that type of detail.
Can I, for my own edification here, this motion is coming now because of the variant. And we didn't consider this, let's say, 6 months ago, 8 months ago.
Right. I think we're also getting to capacity at our hospital, which means that the virus is out there and people are getting sick. I think it also becomes because the employees that were unvaccinated didn't take the incentive, which was very nice. They had 30 days to get 3 days off, $150, and they did not take the nice way to get the vaccinations. So then, if you want people vaccinated or you want to protect the people from people who aren't vaccinated, then you have to go the next step, which is testing.
So
The
if you
issue is, I have the floor. The issue is, if they refuse that, then what do you do? And that's, I mean, leave without pay was actually an option, but I didn't
He's got a good point,
understand. No, I didn't understand the consequences of
Yeah,
it.
and not saying for or against, just if you have enough, 1 or 2, but if you
Well, and I
have
think
10.
that's why we need to, because
yeah,
that's your
that can be a
expertise.
more difficult
Yeah.
situation than the other in some ways.
You know, and the thing you're also not, is they could choose choice 1 or choice 2, and we never even get to choice 3.
So-
And that would be wonderful. If they choose choice 2, I'm on it, because I'm going to protect the people in this building who have cancer, that don't know who's vaccinated and who isn't vaccinated. You're going to protect the people out in the street. You're going to protect the children under 12 that can't get vaccinated. You're going to protect my grandson, and that's important to me.
So if bribing them doesn't work with $150 or 3 days off by putting something in their bodies that they don't want and firing them or sticking a Q-tip up their nose, invading their privacy, doesn't work, then let's just fire them and take their livelihood away from them.
Well, you're not firing them. They're taking
they
a
have a
choice.
choice.
They're making a choice.
That's a great choice.
So you're not firing them, you're giving them choices, and there are 3 choices in there.
What about rewarding them if they're staying healthy and they're unvaccinated?
Well, we try to reward them by giving them money, but
No, by making them take a vaccination. What about if they're unvaccinated and they've been healthy the whole time? What are you doing for them?
I tell you what, they're lucky.
Why aren't
Because they're
you
healthy
rewarding them?
people in the hospital, and if you listen to the doctors that we're dealing with the people on respirators, it's the healthy young people, the college students are on respirators.
No, I'm talking about.
And if you want to
healthy-
talk to somebody that's been on a respirator for 21 days,
No, I'm not talking about people that are on respirators. What are we doing for our employees that are unvaccinated, that have been healthy this whole time? How are we rewarding them?
All right, that's not the motion.
I think you're off on a tangent.
Why? Why? What's the difference?
It's just,
What's wrong with that?
I don't even think there's an argument to that, I'm sorry.
Because they're staying healthy?
I think that's an illogical approach.
And they're here and they're showing up for their job every day?
Yeah, we've never reported here.
What is wrong with that conversation? Sue, what's wrong with that conversation?
Okay, hey,
I'm not even going to go there, Virginia, I'm sorry. It's a ridiculous concept.
It's ridiculous to reward.
I'd like to call the question.
okay, we have a motion, we have a second. Are you all ready to vote? Ms. Powell?
Can you
I'm sorry.
clarify the vote again?
Okay. Ms. Sweeting has stated that our town employees must get vaccinated. If they so choose not to get vaccinated, they must be tested on a weekly basis to confirm or disaffirm of COVID. And if they choose not to do either, then they will be asked to leave or, in human resource terms, terminated.
If I
And
may,
this applies to the council as well?
It's going to have to, if it applies to our town employees, it's going to have to apply to all of us. Am I not correct, Alan?
I think so, yeah.
I would ask when we would start it, if it passes. So when would we start testing? For how long is it until we
2
determine?
weeks. What do you think?
And
Give
then-
them 2 weeks to think it over.
And then the second question would,
I would say we've done it for 30 days. Can we see if the motion passes before we get there?
You need time on it.
Why?
You want to add a date to your motion?
Yeah, let's give it an effective date.
Yeah, give it an effect.
Effective Friday when our police enforcement starts.
so testing starting next week, that would
So
be,
you want to make it effective this Friday?
Correct.
Okay. Ms. Sweeting, in addition to her motion with an amendment, she wants to make this effective Friday the 10th, is that correct? Friday the 10th,
Yes.
September 10th, 2021?
When does the enforcement start? 5 o'clock?
Friday. 5 o'clock
Let's
Friday.
say that, and then we can start testing them if we pass.
And testing will be available when?
Monday.
Can we make it happen that quick?
I would ask.
That's my question. Yeah, that's. very
You're
quick
moving too
turnaround.
fast, Sue, I'm afraid.
I think we could get the test. I would ask the question. I would have to confer with our split shift, our shift work and others to make sure that we would have coverage, because we do have some issues potentially, unless we're asking everyone to come even on their time off. That would be logistically, are we doing Mondays only, Mondays and Wednesdays? We do have a couple of our departments that
And I
have.
think we would say testing starts next week.
Okay.
And that gives you some leeway to talk to Ms. Green
And-
and get your people to do it.
And could you also add to your motion, Sue, that those people that elect to be tested, be paid for the time incurred?
Well, it's going to be done when they're working.
Okay, all right. That work.
Yeah, we'll just have to figure out.
We'll just,
All right.
he has to
Doug,
figure out
do you-
logistics.
You understand the
Yes.
motion? Okay. Everyone still understands the motion with the additions? Ms. Powell?
No.
Doug?
Yes.
Ms. Sweeting?
Yes.
Mr. Harwood?
Yes.
No.
Okay. We have 2 noes and 3 yeses. Motion passes. It will go into effect Friday at 5.
Mr. Mayor, I'd like to announce my resignation as of Friday, September the 10th.
If I may ask, Ms. Powell, would it be possible to wait a few days and confer with council individually?
No, if this applies for the employees, it applies for me as well, and that's the date that you said is, it goes into effect, so that's the date of my resignation.
I'm extremely disappointed, Ms. Powell, but you have to do what you feel's right. Okay, ladies and gentlemen, we're going to be going into closed
Wait a
session.
minute now.
Yes, sir.
I thought this was also billed as the mask situation.
No. We just, Would you like to address the mask situation while we're here?
Hell no, not the vote I just saw.
Okay. Then if we don't want to address the mask situation any further, then we will go into closed session under Article, David?
I don't know how.
Here, up here.
Yes, read that.
Yes,
Thank you for coming, ladies and gentlemen.
Mayor Sellers, I'd like to make a motion to go into.